Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hello, everybody, and welcome to this edition of Podcasts. My name's Katrina James, and I'm an area manager here at Practice Plan. And I'm joined today by our regional support manager, Louise Anderson. Good afternoon, Louise. How are you?
Good afternoon, Katrina. I'm very, very well. Thank you for having me.
So today's podcast is all about the NHS contract reform changes in Wales. Quite a hot topic of conversation. And with us both being local Welsh ladies and very much out there in the coalface with practices, we're quite alive to a lot of the things that are going on, Lou.
Yeah, definitely. We're certainly seeing some practices that are getting quite apprehensive now regarding the changes. And obviously we've had a lot more detail through in terms of what the contract's going to look like from Welsh Government in the last week or so.
Yeah.
So yeah, very interesting times.
It is, and very uncertain times for practices as well. But if we just roll back a few months ago when we were first informed that there were new proposals underway, and we were entering a period of consultation, we had quite a lot of radical information that came out with lots of facts about the DAP and various other things that were due to be implemented, and in particular with regards to how patient management was going to happen. And that caused an awful lot of concern for our practices. We're in a slightly different place now, Lou, but would you like to just talk us through that a little bit more in terms of how you first felt when you had these initial reactions and how you feel, what the practices have fed back to you?
I think that we've been kind of living and breathing this NHS contract since April. Yeah. So since April, when the announcements first came out that obviously we were going to have a new contract in 2026, effectively then we started having contact with practices, informing them that obviously then they had a year to get preparations underway, but we had very little detail at that point as to what everything was going to look like. Then obviously we had the proposals and the consultation period, and practices were very vocal and did a very good job getting that information out to their patients.
Yeah.
With the changes that were coming. Obviously, the biggest change for the patients would have been the dental access portal, the fact that you wouldn't be able to stay with your dentist once you were clinically checked. Yeah. So a lot of noise was made about that. And then obviously in September, we had the Welsh Government announcement that the DAP would be no more. Yeah. That patients that were historic and that were your green patients could now in fact stay with the practice. And also as well, then last week we had the further announcements which gave us the case studies and hammed out how the contract was going to look in terms of the contract segmentation and what practices would be expected to achieve and deliver for the 2026-27 contract.
Yeah, I mean, it's been a lot, hasn't it? There's been a lot of change from what was initially proposed to what's been revealed now. So the element of we've listened and we've made those changes, but the changes are happening and they're quite significant changes. But from your perspective, I mean, I know the devil is always in the detail when we get down to this sort of thing. What are the real key things and the key changes that practices really need to be aware of?
The key changes that practices need to be aware of are their patient base and their patient modelling. Yeah. So historically, we treated patients that are routine and they come into the practice and we see them every 6 months for examinations. That has changed slightly with contract variation and reform. And now most patients that are dentally fit and well are going to be seen on a 12-month basis. Obviously, with this new contract, that is going to be extended. So patients are now going to be in a situation where they're possibly not even going to be recalled at all. Yeah. But with a very minimum period on that of 2 years. I think the practices need to look at how they're going to be able to diarise and how they're going to move forward with what their book's like. It raises a lot of questions. I think that practices are going to be taking a lot more patient complaints. That's certainly an area where I think that practices are going to feel it a lot more. That is due to obviously the patient charges going up so significantly as well. Patients are going to not be used to paying the NHS charges that of the likes and of what we're hearing and seeing that we're going to be charging patients.
Absolutely. I mean, it could be up to £384 for their care package plus lab fees. That's a whole new element, isn't it?
Absolutely. So I think that practices need to have a look at how their practice currently runs, what the new contract is proposing. So obviously we've got 20% of it that's going to be capitated. Then we've got 70% that needs to be delivered on urgent care. On care packages. Then we're going to have the urgent care. Then we're going to have the access. Then we're going to have the new patients. And we know that only 3% of the contract value is going to be there, which is part of our 20% capitated payment for patients to be able to see their recall patients. So I think the practices, what they need to be doing at this stage is having a look at their patient base. Working out also how many new patients they're going to have to take on under the new contract. The problem is that because this and the regs are not coming out until the 2nd of February, the problem with all of this is that you're not going to get the level of detail that you need to make these informed decisions. So we're on a timeline. So I'm dealing with practices at the moment which are really in probably 3 camps. So we've got the practices that are absolutely no way, don't want anything to do with the new contract, and obviously we're working towards getting them out of the NHS by the 31st of March, but that does mean that they have to give notice to local health boards on the 31st of December. It's the 4th of December today. That's not a very wide time.
It's very tight, isn't it? That obviously that's if they want to exit the current contract and not engage on the new contract.
Absolutely. I've got other practices that are waiting until they actually get the detail of the contract to see how many new patients they're going to need to see and what the metrics look like for them once they get that deep. But with a view to, we know that we've got this issue with the recall bullshits. So a lot of practices that I'm talking to at the moment, what we're looking at are their plans. Are they plans fit for purpose? And if they haven't had plans before, we're setting up new plans for new practices so that we can look at supporting them and their current patients with a more sustainable model of staying with the practice.
Yeah. I'm seeing a lot of that myself also, Louise. It's very much so, because those are the patients who've been coming routinely, keeping care of themselves, and they are the ones that are being compromised in terms of their recallability, isn't it?
Absolutely. And that's the main issue I think the practices are facing, is the fact that they're going to be having to take on such a large cohort of new patients, having to take on such a large cohort of urgent patients, that it's the unknown as to who they're treating, what they're treating, what medical history problems these people may have that are coming in. You haven't got the software capabilities either. How are we going to monitor all of this? How are we going to make this work?
Yeah. Now, you mentioned there were 3 cohorts of practices. We've gone through 2. What was the other one?
The other ones are, we're gonna give it a go, and we're gonna see how this goes. We're very adaptable as a profession, but I do think that a majority of practices are currently sitting in that middle ground where we're going to obviously try and grow the private element within the business and with plan within the coming year, and then see where we are as a result then of that at the end of 2027.
Yeah. I mean, it is a lot for people to think about, isn't it? And, you know, a lot of practices, they really want to keep a foot in the NHS camp and try and offer that provision for patients as fundamentally why they had it initially. But the complexities of this contract and how you can deliver it and manage the recalls of the patients, all the other metrics, you know, local initiatives and things like that they've got to get engaged into, really are struggling to understand how they can make it work. And you're right, I'm definitely speaking to a lot of people who are, well, we're just going to have to stick a toe in the water, try and see. A lot of talking about rebasing just to make it more viable as well. So, I mean, obviously you've mentioned a lot of things, Lou, you know, such as the software challenges, the breakdown in the care packages, etc. I mean, in terms of day-to-day operations at a practice, and I know you've managed lots of practices and, you know, overseen a big business operation, how would you go about, you know, thinking where the biggest impact is going to be for your day-to-day operations trying to work under this contract?
The first thing is understanding the metrics. And I think that's the biggest thing to get your head around is the percentages. How are you going to do that? A lot of this contract is going to come down to skill mix.
Yeah.
So it's going to be utilising your current skill mix within practice. So I would be looking at things like who can deliver oral health, who can deliver fluoride varnish clinics.
Yeah.
Utilising therapists, utilising the staff that you've got within the practice to try and maximise how much of this can be delivered by the wider team. I think going to be really important and a really key value that you need to take away. So things that I would be looking at are, have I got enough staff that are able to do this for me? If not, getting them on courses, making sure that this is something that we can deliver. Trying to deliver the capitated side of it as efficiently as possible. So we know that a lot of it is going to come down to prevention and advice. So, for example, if you are seeing children, yes, under the contract value, it sounds very appealing, 0 to 1 year old, £80 that the government will give you. But we know for that, you're going to have to do things like prevention. You're going to have to sit there with the parent or guardian of the child and deliver then oral health care. And they suggested a half an hour appointment for that. I'd be looking at ways to do a digital version. So that you could deliver the message digitally, and that maybe you could deliver that then via email to the patient to say, because you don't want to be taking half an hour of surgery time, and for somebody to sit there with an under 1 year old on your lap for half an hour is not going to be. So I would be looking at different ways to deliver it as efficiently as possible, without obviously taking that precious chair time. Then I would be looking at my patient base. The first thing that I would do would be seeing how many green patients we got, what 3% of that looks like. So, for example, if you've got 1,200 green patients, work out what 3% of your actual contract value is, and then have a look at realistically how many of those patients you're going to be able to see in a year. Start having conversations with your team, start having conversations with patients. Preparation is key for all of this. And I think that the more information that we can deliver to the public as well ahead of April, going to be really beneficial.
I think that's such an important point there, Lou, because we know there is no patient-facing information at present. I know it's in hand that something is being drawn up, but as we stand, patients are already aware of the initial consultation proposals that kind of got out through practice, engagement, and, you know, signposting the changes that were coming. And I mean, there are going to be a lot of good discussions to be had with patients, particularly as we're coming up to the end of this, you know, this period, you know, those on treatment plans, what's going to happen to those? How are they going to pay when it comes, you know, if they're crossing over between March and April? There's a whole lot of different things to discuss in addition to just when you can book your next appointment, isn't there?
Definitely. And I think that having your team as prepared as possible as well. So I would be certainly informing the team as to what is coming and making sure that they know what the things like the post-patient charges are going to be and what the care packages include. How are we going to actually run the business going forward? I know that we haven't got all the details and everything at the moment, but with the information that we've got, I would be trying to get as prepared as possible. And certainly having a look at how I could deliver the contract if I'm going to stay in it.
Yeah, and it's so important. Preparation is everything now, isn't it? I mean, where do you see positives or opportunities coming from in these changes? I mean, access, obviously, for those who currently can't get it is one of the main reasons for doing this. You had any other thoughts?
Obviously, you've got the access, but then I do have slight reservations about that as well, because I feel as if we're trying to create access for possibly part of the population that doesn't necessarily want that service from us. Sorry, I'm back into the negative.
Well, no, you are right. I mean, I understand exactly what you're saying, and that's definitely things that have been relayed to me from practices also.
From a positive point of view, I suppose that the patient charges going up can be seen as a positive.
Yeah.
The reason being is that obviously we've been very, very far behind England on our NHS patient charges for a number of years. So we haven't had those increases that England have to their UDA rates. So I do feel, and the patient charges, so I do feel as if that would be a good thing, because it is far more clearly aligned with where the patient charges need to be for this treatment. That said, patients haven't been used to paying the kind of charges that we're going to be discussing and that we're going to be looking at with this contract. The other positives, I do like the fact that we are going more prevention-led.
Yeah.
I think that is definitely a positive for patients and for practices. And then I suppose it's just the fact that we are getting away from a UDA way of working and moving towards more of a needs-based, time-based model. In theory, it sounds all very well. I just think that in practice, it'll be a lot more difficult to deliver.
Yeah, and I agree and confirm everything wholeheartedly what you're saying there. These are definitely what we're discussing, are conversations I'm having with practices and hearing the same or very similar feedback about it all. I mean, I know you and I could chat all day about this because, I often come to you and pick your brains about lots of different bits and pieces because I know you eat, sleep and breathe this at the moment with all your practices. But I mean, for our practices, in terms of the key things that we can be supporting them with now, I think you've obviously highlighted quite a few, but just for those listening out there, I mean, how can we be supporting them regardless of which way they're thinking of taking their business? How can we support them through this time?
The first thing that I would look at is obviously if you haven't got a plan provider and you are looking at trying to do this NHS contract, I see that the plan and the NHS contract have to work together because you can't deliver one without the other. So first thing I would say is get in touch with us, have a conversation with us. We can guide you through, we can help you, and we can definitely look at ways that you can communicate all of this out to your patients. The other thing that I would suggest is that we have a look at your patient plans. We need to be looking at is to make sure that, number one, your fee per item charges are correct and that they're not priced too low, especially against the new NHS charges that are coming in. The other thing that we need to do is, if you do have plans in place, look at those. Are they fit for purpose? Are you just offering a 2+2, for example, because these patients are very different to patients that you would just normally try to get on plan? So I would suggest looking at an annual plan, which would then obviously replace one examination, one hygiene. And I would look at what you're offering in terms to these patients. The other thing we can help with is practice marketing, practice literature. I'm currently working on a patient-facing letter as well that we can send them practices, showing them the changes and offering them a more stable way of continuing to see their dentist and their clinician and giving patients peace of mind as well. So that is where I would start. Then obviously as we get more details and as we get further information, then we can build upon that. But having conversations with your staff, with your patients, getting your plans in place is certainly where I would start for now.
Yeah, no, you're absolutely right. That's exactly what practices need to be doing. I think, for the business owners out there who are sitting still uncertain where they're going to go with this, those in particular who are waiting till February before they come to any sort of formal decision. Obviously, by the time they get there, we're into different notice periods, So there's all these sort of things that we've got to consider, but we are here to help. We can talk practices through their options, staying, leaving, middle of the road. We're there to discuss and support with everything, and draw on the expertise that we've got across the team to help them through this time whilst they navigate what is ahead. Lou, thank you ever so much. I mean, I'm sure we will be touching base again in the near future with regards to this, and I know you've got some more webinars lined up ahead, but thank you very much for giving me an insight into what's going on in your mind with your thoughts with regards to the contract and how we can be supporting our practices here in Wales.
Thank you, Kat. Diolch yn fawr.
Diolch yn fawr I chi. Thank you very much, everybody, for joining us. If you'd like to find out more information as to how we could be supporting you and your patients, please do contact us at Practice Plan. Thanks for joining us.